Nobody wants to tell you this, but one of the biggest taboos you face after 65 is the question of how your sex life has changed. And trust me, it has changed more drastically than you care to admit. You might feel like everyone is avoiding the topic because it's too embarrassing, too personal, or just plain uncomfortable. Well, here I refuse to hold back. I'm diving headfirst into the awkward reality that senior intimacy isn't anything like the movies or brochures at your doctor's office make it out to be. Think of this as a wake-up call for your bedroom, your dignity, and your sanity. Because if you don't get real about these issues, they're going to sneak up on you and leave you feeling lonely, frustrated, and maybe even scared. So push aside that polite conversation. Let's expose 7 uncomfortable truths about senior intimacy that nobody wants to address. And let's talk solutions. Yes, solutions, because I'm not just here to wreak havoc and scare you. I'm here to make sure you don't spend your golden years twisting in the wind, wondering if you're the only one dealing with these issues. So buckle up, because we're about to get brutally honest. First uncomfortable truth, dryness. And I'm not just talking about a little bit of dryness. I'm talking about the desert dryness that can make sexual activity feel about as appealing as rubbing sandpaper together. You might think you're the only one who experiences that stinging or burning sensation, but let me tell you, it's the elephant in the room for a whole lot of folks over 65. It's not just a female issue either. Men can experience their own version of dryness in the form of skin changes and decreased fluid production. It's humiliating to bring up, and you might even feel shame, but ignoring it can lead to painful intercourse or frustration that eventually pushes you or your partner to give up on intimacy entirely. The good news? Solutions exist. Over-the-counter lubricants, prescription creams, hormone therapy if you're a candidate, and, more importantly, honest communication with your partner. You can't fix a problem you never discuss, so speak up, see your doctor, try different products, and do not be ashamed. If you hear me loud and clear, go ahead and comment hard truth if you've experienced dryness, and do it proudly, because you deserve relief. Second uncomfortable truth, the dreaded performance anxiety. This is for all genders, folks. You might be worried about losing your erection, or you might be worried about not being able to reach orgasm. Or maybe you stress about not satisfying your partner like you once did. Let's cut the nonsense. That's normal, especially as you age. Your body just isn't what it used to be. Blood flow changes, hormone dips, and even something as simple as not feeling confident in how your body looks anymore can shrink your libido in a heartbeat. But here's the kicker. The anxiety itself often makes the problem worse. When you freak out about performance, your body goes into fight or flight mode, which kills arousal. Vicious cycle, right? To bust through it, try relaxation techniques, breathing exercises, or focusing on non-goal-oriented intimacy. You don't have to end with a Hollywood-style climax every time. Sometimes physical closeness and emotional connection are enough. Talk to a counselor or sex therapist if you need to. Because let's be real, if you had a bum knee, you wouldn't feel shame about seeing a specialist. So why does feeling anxious about sex have to be a secret? Don't let pride keep you from giving yourself permission to seek help. Third uncomfortable truth. Yes, your desire really does fluctuate like a roller coaster. And sometimes it goes so low, you barely even think about intimacy. We're fed this lie that if you've had a healthy sex life your whole life, it should continue seamlessly. That's not always the case. Medication side effects, depression, chronic pain, or a changing relationship dynamic can drastically shift your libido. Then there's the fact that some seniors feel guilty or uncomfortable even wanting sex if their partner is ill or incapacitated. This is a real messy emotional landscape. Here's where I tell you to be honest with yourself. If your desire is plummeting, examine what's behind it. Talk to your doctor about adjusting your meds. Seek therapy if it's depression or emotional stress. Explore alternatives with your partner. Intimacy isn't just the physical act. It can be touching, life-sharing, sensual massages, or anything that fosters closeness. Stop comparing yourself to who you were at 30. You aren't that person anymore, and that's okay. The human body evolves, and so does desire. Fourth uncomfortable truth: you might feel unattractive. Aging doesn't always feel graceful or sexy, does it? Wrinkles, sagging skin, extra weight. Nobody wants to say it out loud, but these changes can kill your confidence quicker than you can say, "silver fox." Society bombards us with images of youth and equates sexiness with a body that's decades behind us. So when you see that naked reflection in the mirror, you might cringe. That shame and insecurity will sabotage your entire intimate life if you let it fester. So let's not sugarcoat. You're older, your body is different, but that doesn't mean you can't be desirable. Remind yourself you've earned those wrinkles. They're your life's roadmap, not an alarm bell that your bedroom closings have to stop. Simple practical tips: wear lingerie or clothing that makes you feel comfortable. Dim the lights if you're self-conscious, or focus on the sensations rather than your appearance. Engage in exercise or gentle yoga just to keep your blood flowing and your body in better shape. This is about feeling confident in your own skin, not matching some magazine cover. If you need a sign that it's okay to let your body just be what it is, this is it. Fifth uncomfortable truth: past traumas or regrets can resurface as you age, turning intimacy into a minefield of emotion. Maybe you had a sour relationship, or maybe there was some unresolved trauma in your younger years that you pushed aside for decades. Now in your 60s, 70s, or beyond, those memories could pose a huge barrier. It might manifest as fear of touch, unexplained anger, or aversion to certain acts. If you're noticing that, do not ignore it. Therapy isn't just for the young. It's for anyone who needs to process muddy emotional waters. And guess what? There are specialized therapists who focus on senior relationships and sexuality. Even if therapy feels taboo for your generation, do it anyway. Don't let your old wounds keep you from enjoying closeness in the years you have left. Painful as it might seem to resurrect that part of your life, facing it is infinitely better than letting it silently ruin your present. Sixth uncomfortable truth: medical conditions will sabotage you if you don't address them properly. Whether it's diabetes, heart disease, arthritis, or something else, your health can make sex complicated. If you've got arthritis, even certain positions can be agony. If you've got heart issues, you might worry that sexual activity will push your heart too hard. And if you have diabetes, you might battle neuropathy or decreased sensation. Let's not pretend that's easy to deal with. This is the part where you swallow your embarrassment and ask your doctor the questions you're too shy to bring up. Yes, your doctor has heard it all. You're not going to shock them. Ask for specific suggestions, medications, or physical aids. Maybe you need a different time of day for intimacy, or you need pillows or specialized furniture for comfortable positioning. If you're worried about your heart, ask if you can do some mild exercise training, because guess what's more embarrassing than talking to your doctor about sex? Giving up on intimacy entirely and suffering in silence. So open your mouth and get the information you need. Seventh and final uncomfortable truth: many of you just give up because you believe the lie that old age means no more pleasure. Maybe you think you're too old to be messing around in the bedroom, or you hold on to some outdated notion that seniors aren't supposed to be sexual beings. That is the biggest myth of them all. Your sexuality is part of who you are, from cradle to your final breath, and it doesn't magically stop at a certain birthday. Are things going to look different? Absolutely. But different doesn't have to be terrible. It can be slower, more intimate, deeper, and in some ways even more meaningful than it was when you were younger. You have the wisdom to appreciate closeness, not just the physical release. However, you do have to do the work. You have to talk openly with your partner, experiment with new approaches, try products you never thought you'd buy. This might push you out of your comfort zone, but if the alternative is a lonely bed and a sense of regret, which would you choose? If you want to fight this myth, drop your comment with Seniors Confess to let everyone know you believe in your right to intimacy. So there you have it. 7 uncomfortable, often embarrassing truths about your sex life after 65. Let's run through a quick recap. Dryness is more common than you can imagine. Performance anxiety cripples your ability to enjoy. Shifting desire wrecks your expectations. The mirror can be your worst enemy unless you confront shame. Old traumas can surface and sabotage your now. Untreated medical conditions will drag your bedroom life into the dirt. And finally, the tragic habit of giving up altogether makes everything worse. If you swallowed your discomfort and listened this far, I applaud you. It means you're serious about finding real solutions, not just politely ignoring the problem. If you're new here, I invite you to subscribe for more raw, unfiltered truths that nobody else dares to address. And be sure to smash that like button if you appreciate the honesty you're getting today. Comment, shucks your hard truth if any of these 7 points hit home. Remember, you deserve a fulfilling, satisfying life at every age. It's not shameful, it's human. Acknowledge your body, embrace the changes, and get proactive. Don't let anybody, not even your own doubts, convince you to hang up the closed sign on your sex life. You've got years left to enjoy, so dare to face the brutal truths and then do something about them. Now go out there and reclaim what you thought was lost.